Good afternoon and welcome. Thank you for being here today. My name is Sarah Rayburn. I'm the Executive Director of the Plumbing, Heating, and Cooling Contractors Association of Texas. Welcome to the first of 3 events in PHCC's COVID-19 Roundtable webinar series. We want to extend a special thank you to our presenters who are making today's event possible, but we also want to express our appreciation to all of you who have joined us today. During today's webinar, you're welcome to submit questions using the Q&A function in Zoom on the bottom of the screen. We will do our best to get to answer every single question, but if we can't get to your question, we'll be happy to follow up with you afterward. To say that these are unprecedented times would be an understatement. Given the legislative challenge our industry will face in 2021, we knew that 2020 would be a busy and challenging year, and that's before the coronavirus arrived. But we will get through this, and one of the ways we will do so is to share our experiences and insights with each other. That's our goal with PHCC's Roundtable webinar series, and we hope that you will hear and learn some insight that might help you in supporting your company and family during this unprecedented time. The coronavirus has reinforced to our state and country what we recognize each and every working day, and that is that our industry is essential. We've been asked to step up, assume risks, and do what we need to do to keep our country moving and safe. PHCC remains committed to providing the support, training, and leadership our industry needs to keep you informed and prepared. We also remain focused on our preparations to fight for continued statewide licensure for plumbing when the Texas legislature convenes again in 2021. But as we move forward, there will be challenges. There's uncertainty about our economy, and there's lots of job loss and tough times ahead. PHCC is committed to making the journey easier, to supporting you, and to speaking up for what matters most. I'm pleased to report that our training classes have resumed, and we'll speak more about that in a moment. I'm also pleased to report that PHCC continues working on your behalf with industry leaders, the State Board of Plumbing Examiners, and other stakeholder organizations as we look to the future. I'm happy to share that PHCC continues to build a comprehensive grassroots outreach plan to reinforce to legislators the importance of continuing to license Texas plumbers. Over the next 3 weeks, these webinars will provide you with information about all of our efforts that will answer questions, provide guidance, and offer you insight that will help you enable you to persevere. I'd like to begin our webinar series by laying out our path in the months ahead that will culminate with our work to stand up for you at our state capitol while we continue to ensure that you have the support and training that you need to carry on and provide for your companies, your communities, and your family. As you know, our state's stay-at-home order expired on May 1st. Texas continues to slowly reopen for business, and only time will tell just how soon we'll return to normal, if at all. To provide guidance on the reopening process, minimum standards for health protocols outlined by the Texas Department of State Health Services are recommended and can be found along with the governor's Open Texas report at open.texas.gov. Additionally, there are a number of resources available from the PHCC national website under the COVID-19 Recovery Center. It may not be entirely business as usual, but our industry will continue to be called upon to provide our services, and Texans will continue to expect that our preparations, our work, and our accountability will remain of the highest standards and in accordance with the expected health protocols outlined by the state. In early May, the Texas State Board of Plumbing Examiners resumed examinations to replace those that were previously postponed due to COVID-19. Openings for exams are limited due to social distancing precautions. The email address associated with the examinee will be used to notify those affected of changes, any changes to their scheduled exam date. The board is also now accepting continuing professional education correspondence courses in lieu of classroom courses to meet the training requirements for the tradesman plumber limited 24-hour training courses. It has also eliminated the need for the second classroom CPE for the 48 hours on the journeyman requirement for examination. Remote examinations began around June 8th in some areas. Examinees are encouraged to keep an eye on your email and your text messages as those exams are being rescheduled. Licenses and registrations expiring on May 31st now show a disaster relief credit on the state's public site. These relief CE markers will allow licensees and registrants to renew their licenses, assuming that all other requirements have been met. You will need to go ahead and continue your completing your education requirements in order to receive that credit, receive and maintain that credit. Additionally, the next Texas State Board of Plumbing Examiners meeting will be held on June 18th, and it will be held over Zoom. You can find more information about that meeting and other information about any changes that the State Plumbing Board is currently making on the State Board's website. In terms of our economy, the state's latest unemployment figure of 12.8% is the worst on record for Texas. Since mid-March, 2.2 million Texans have filed for unemployment, and that number exceeds the total number of people who filed for unemployment during the entirety of 2019. Sales tax collections, the state's largest source of revenue, was down 9.3% from April of 2019. While state revenues are falling, social and healthcare needs of Texans are increasing, creating pressure for more funding and setting in motion what will be a frenzied budget battle during the next legislative session. Additionally, we will have a new speaker, new committee chairs in the House, and a focus on redistricting. While state leaders are expected to consider tapping into the state's rainy day fund to address an expected budget shortfall, this will make our work next session even more important as we attempt to break through the noise of the state budget battle to keep lawmakers informed and focused on the importance of statewide licensure. Certain programs like the Paycheck Protection Program have helped get money in the hands of those needing it most and will hopefully have an impact in keeping oxygen in our economy. If you have not done so, we would encourage you to see how this program might support your company. Part 2 of our webinar series on June 18th will focus on the 2020 elections and our preparations for the legislative session. I am happy to announce that our key legislative contact program that we were forced to delay this spring due to the coronavirus will resume in a virtual format without in-person contact this summer. For those of you who have already volunteered to participate, you will be hearing from us very soon on the next steps in that process. If you have not volunteered to participate but are interested in becoming involved, please reach out to us and we would be happy to get you connected. In the coming months, we will continue to keep our membership updated on key developments affecting our industry through our updates from Austin. In addition, we are launching a quarterly town hall webinar for PHCC membership that will provide live updates and presentations on important issues and developments affecting our country. This will also be an opportunity for us to connect with you all and answer any questions or items of importance that have come up in your areas. Finally, I wanted to update you on PHCC's efforts to resume our training schedule and additional steps that we're taking to accommodate you and your training needs. To do that, I would like to ask Jody Davila to join me on screen to provide that information.
Thank you, Sarah. Again, my name is Jody Davila, and I'm the Director of Communications and Curriculum Development here at PHCC Texas. And the past few weeks have been pretty challenging for everyone, and we hope that you and your family are all safe and healthy amid this whole crazy pandemic. We feel really fortunate to be able to welcome our students back to in-person training. We've definitely missed you guys. The office just isn't the same without it being full of students in our hallways. And again, I did want to point out that we do regret and apologize for the numerous cancellations that we've had in the past few weeks, along with the rescheduling of our training courses over the past few months. But safety and the health of our members and students and staff was and will remain to be our #1 priority right now amidst the changing climate of this whole pandemic and our whole new normal. Our actions were in response to state and federal guidelines issued at the time. As those guidelines have begun to start to get relaxed, we're moving forward and resuming our in-person classes where possible, as well as continuing our online and correspondence options. We've had some great success with the live online Zooms. It's been really fun to actually see how this process has played out, so we definitely want to keep those moving. We now have a staff member that's dedicated entirely to processing correspondence courses. which allows us to continue our guaranteed 24-hour turnaround period. And as far as our in-person classes go, we're taking all reasonable preventive measures regarding COVID-19 at our in-person trainings, as well as providing information and support to all students prior to and during the training in accordance with all local health authorities. So some of the new protocols that you're going to see when you come to our in-person class includes all students and course instructors are now required to wear face coverings during every single course. Students will participate in wellness screens as part of the check-in process, and instructors will now perform a body temperature reading prior to the student entering the classroom. As far as social distancing, we're going to leave every other chair open to maintain the 6 feet apart, and students will also be asked to remain 6 feet apart during the registration and check-in process. Again, these are changing times, and our protocols and procedures are changing sometimes every day, weekly, depending on the recommendations. But just know that that we have our students and members' health and safety as our #1 priority, and that will remain our #1 priority moving forward as we adjust to your ever-changing schedule being essential. Thank you for your understanding and patience during this time, and thank you so much for your service to the citizens of Texas. And Sarah, I'll go ahead and hand it back to you if there's no questions for me at the moment, which I'm not seeing any. If you think of a question or a comment after the end of this program, please contact me directly. All of my information is listed on our website.
Thank you, Jody. And with that, I will move us on to the next part of our program. We know that human resources issues have been a particularly important issue during this time that many of you have faced. With us today to review some of the key HR issues that you've been faced with in recent months are Sheila Price and Carla Saenz from eEmployer Solutions. We're pleased to have these two experts with us today to share their industry insights. Before I invite them on screen, I would like to remind everybody that if you have any questions during the webinar about the first portion, about any training questions or anything for Sheila and Carla regarding HR issues and COVID-19, please feel free to use the Q&A function to ask those questions. We will get to as many questions as we can, and if you have any questions afterward, you're always welcome to reach out to us as well. At this time, I would like to invite Sheila Price and Carla Saenz to join the screen.
Hi, Sarah. Thank you so much for having us, and thank you to PHCC for allowing ESI to be part of today's presentation. So today we're going to talk about HR issues, COVID-19, and moving forward. On our next slide, we will talk about our agenda. So today we will briefly cover the emergency sick leave and emergency FMLA laws. We will talk about documenting your return to work plan. Also, what happens and what you do if someone tests positive for COVID. Also, what happens if an employee refuses to return to work? Also, how to keep your workplace safe and healthy. And finally, tips on how to re-engage employees. On our next slide, we have a few housekeeping issues. We will move quickly today, so we may not be able to cover everything. So as Sarah mentioned, we ask that you use that Q&A section down below. If you hover over the bottom of your screen, you'll see that section. Also, the situation and the laws are changing frequently, so we encourage you to visit your local, state, and federal websites in case you have any questions. Also, visit your HR professional or speak to your lawyer. Also, this webinar is not suitable for legal advice, and the slides will be available at a later date. So let's just dive right into it on our next slide. Let's talk about the Emergency Paid Sick Leave and the Emergency Medical Leave Act. So on the next slide, it talks about the FFCRA, which stands for the Families First Coronavirus Response Act. This was enacted on April 1st, 2020. Just so you know, there are posters that are supposed to be posted in your workplace. You can visit the CDC, the DOL, or the OSHA website to gain those posters. Just very briefly, this act, the FFCRA, has an emergency paid sick leave option and an emergency family medical leave act option that can pay employees who are sick due to coronavirus or need to care for someone who has the virus, or if an employee is unable to telework and has no child care, they could also receive pay under these two acts. Again, visit the local websites that we've talked about for more information. On to the next slide. Let's talk about returning to work. Most of you have already been working through this COVID-19 situation. However, now you may be thinking about bringing back some of your admin or office staff. So let's talk about that just a little bit on the next slide. Where do we start? So in HR, we always make a joke and we say, document, document, document. So this is one of those jokes, document your plan. So document your plan for reopening. When discussing options for reopening or returning to work, incorporate all members of your management team. This may bring up new ideas or issues that you previously didn't think about. As I mentioned before, these websites will become your left and your right hand. The CDC, the EEOC, the DOL, and OSHA are great websites for information on documenting your plan. Return to work offers should be documented and letters should be given to employees. The letter should include a clear date by which the employee must respond, and you also want to include language that failure to respond by the given date will be treated as a refusal to return to work. Include a statement that refusal to return to work may disqualify them from unemployment benefits. If an employee refuses to return to work, you as the employer must notify the Texas Workforce Commission, which we will have that information on the last slide of our presentation for you. As I mentioned before, gradually bring back your employees. Bringing everyone back at the same time could cause concern for one's health if there are too many people in the workplace. Also talk about cleanliness and your policies and procedures for returning to work. Make sure you share those with your employees. It has been proven that employees who have a return to work plan are more engaged and reduce turnover. Be sure to disinfect all areas of the offices. Consider hiring a professional company to come in and disinfect your office if you're unsure on the proper guidelines. One thing I want to mention to you is to make sure and visit OSHA.gov website for PPE or personal protective equipment such as masks, gloves, and face shields. OSHA has made some guidelines and has made some employers required to give this PPE equipment to employees and customers. So be sure to visit that. I do want to let you know that the International Association of Plumbing and Mechanical Officials does have a few guidelines on PPE and protecting yourself during COVID, which we will go over shortly. One kind of important area to consider when you're bringing back your employees is doing this temperature taking and asking COVID-19 related symptoms. The EEOC has allowed these two options. However, I encourage you to take precautions before implementing this testing. Keep in mind, you must pay your employees while they are waiting to be tested and while they are also waiting to receive results. So let's go over just a few important things. So provide testing in a confidential setting. If you're going to record the information, which I highly encourage you do, keep that information confidential. So what do I mean by this? So I want to give you an example. So if you are testing people and you have a corner office and you have a line of employees standing outside of your office and you happen to turn away an employee because he or she has 105 fever, you turn that employee away and then this line of employees watches that person walk off, and now you may start the rumor mill by saying, oh, did you just see so-and-so? They were turned away from work and sent home because they had a high fever. So you don't want to start the rumor mill, and so you want to take precautions. Do it one by one and try to do it in a confidential setting. If you record the information, I encourage you to record the information maybe on an Excel spreadsheet or a Word document. Password protect this document and only share it with very minimal or few people who need this information, and limit who has access to this information. Also, don't single out employees. If you happen to have multiple shifts, don't just do the first shift or don't just do the second shift, or maybe only the plumbers or maybe only the apprentices. Make sure you test everyone at the same time. And one final note here, One of the key topics has been antibody testing. The EEOC has not approved antibody testing, so my suggestion to you is not to do it. Also, if you incorporate any other testing besides temperature taking or asking COVID-19 related symptoms, these are not covered, and you must register these with the CDC before you administer the testing. So now that we've talked about where to start, let's dive a little bit deeper into the next slide and talk about a few considerations you should take when you're documenting your return to work plan. I want to encourage you to close common areas. So areas such as the water fountain, areas such as your break room, your coffee maker, your water cooler, you may want to consider closing those areas. If you don't feel comfortable closing those areas, let's put some signage up that says only 1 or 2 people are allowed in here at this area. Be sure that you have disinfectant wipes and hand sanitizer to make sure the employees use those 2 things when they are finished with the equipment they're using, such as the coffee maker or wiping down the handle of the refrigerator, things of those nature. Again, as I mentioned, if you have shifts, consider staggering your shifts and lunches. So if you usually have a group of people that goes to lunch at 11:30, maybe try to stagger it between 11 and 1 p.m. or something of that nature. If you need help with that, reach out to us and we can help you with that. Also consider using your teleworking options. So if you have employees that are continuing to telework, if that's working for you, let them continue to telework. However, if there are issues there, of course, reach out to your HR professionals and we can help you there. Also, one of the other things I want to mention is try to keep your meetings virtually. If you happen to need to use a conference room, as Sarah and Jody mentioned, they are taking precautions in their area where they're every other chair, every other section, face mask coverings, things of that nature. So just make sure you're following those guidelines. And last but not least, if an employee feels ill, make sure you send them home. Sometimes this could obviously hurt the employee's feelings, but the one thing I want you to remember is compassion is the one factor that gets employers into trouble. However, compassion is showing care and understanding in one situation. So communicate with your employees. So much like document, communicate with your employees. Let them know that you're only looking out for their best interest and you want them to get healthy at home. So if you have any other questions, feel free to reach out to us or to your HR professionals or even PHCC. So on our next slide, the last thing that you want to talk about is reviewing your handbook policies when you're documenting your return to work plan. So now is a great time to pull out your handbook and review your handbook. When's the last time you looked at your PTO or sick policies? When's the last time you looked at your attendance policies, your rehire policies, things of that nature? Do you need to amend your leave of absence policy or your PTO policy to fit during these times? One example of that is some employers in Texas will pay out people's accrued PTO time or sick time when they leave the company. Keep in mind, this could be a financial hardship on the company right now, so you may want to revise your policy book to change that policy at this particular time. So that's an example of changing your PTO policy. Or maybe instead of a use it or lose it policy, maybe you let your employees roll over a couple of hours into the next year. Also, do you have plans in place to cover someone who is on a leave of absence with COVID-related symptoms, or even if they have COVID? What is your company's process for requesting and documenting a leave of absence? Also, do you have a plan in place? I'm sorry. Do you have a plan in place of who to bring back? Are you looking at laid off employees and furloughed employees? Keep in mind that laid off employees do not need to be rehired. However, your furloughed employees should be brought back to work, as that was the idea of furloughing an employee. One other thing you want to keep in mind is, do you need to re-verify an employee's I-9? On an I-9 form, at the very bottom, there is a Section 3 section. This section can be used for up to 3 years from the last day that the employee worked for re-verifying their employment. However, keep in mind if the original documents that they provided on day 1 of employment prior have expired, you do need to re-verify their documents, and keep in mind people cannot use expired documents for an I-9. Last but not least, on this section, I want to talk about background checks and drug tests. Look at your handbook and see what your policy says about doing background checks and drug tests on rehiring employees. If for any reason you are going to look at doing background checks and drug tests on rehired employees, make sure you are remaining consistent and fair to all the employees. Do you have a particular contract where those employees working on that contract have to be background checked and drug tested? That's okay, you can do that. However, make sure you are doing it for everyone on that contract and not just the laborers or not just the apprentices. Make sure you're doing it for everyone. Again, remaining consistent and fair is the key here. What you do for one, you must do for all. So last but not least, on the next slide, let's talk about training your management. Training your management is important, and your frontline employees is important because they need to understand what's going on, what are the symptoms of COVID, how do you keep your appropriate cleaning, disinfectant, and hygiene, and also train your management on any changes or updates that you've made to the handbook and retrain them on policies such as the PTO, the leave of absence policy. Also train them to listen for negative comments made about the new laws that have been enacted or even COVID, or if an employee feels like they're being treated unfairly. Be sure that you have proper hand sanitizing, disinfectant wipes, tissues. Make sure you're posting the signage that reminds employees to wash their hands often, to wash them for 20 seconds. Also, one other thing I'd talk about here is I would discourage your employees from using each other's workstations. So what I didn't mention before is if you are bringing your employees back to work, consider having them sit in every other cubicle. If you have cubicle stations, make sure you're wiping down those areas. And also, like I said, if they're not sitting at their normal cubicle station, make sure you wipe down that station before they sit there. So again, if you hear any negative comments made by your employees, make sure you're reporting that to management or your HR officials. So next, let's talk about our in-home visits on the next slide. So as I mentioned before, according to the International Association of Plumbing and Mechanical Officials, they encourage you to use cleaning agents with claims against viral pathogens. They also state, continue to use the guidelines issued for dealing with human waste and related materials, such as washing your hands often, using face and gloves coverings. Also clean and disinfect all areas and tools that you use frequently. Again, remember to social distance, avoid sharing your tools, and again, stay home if you are not feeling well. And again, teach your management team on the symptoms or the signs of anyone that may feel ill or have COVID-related symptoms. So it's very important to keep your management team up to date with everything that's going on. So now I'm going to turn it over to Carla.
Thank you, Sheila. So next we're going to talk about what to do if an employee tests positive for COVID-19 in the workplace. So on the next slide, we'll talk about what we should do. Our best recommendation is to have a plan in place. So you'll see on the next slide that we have some things to do in case of a positive test. So as we mentioned, have a plan in place, and you want to make sure you train your manager so they know what to do. If you're going to do self-testing, whether that's temperature checks like we talked about or screen for symptoms, as Sheila mentioned, make sure your managers know what they're screening for. So during times of a pandemic, it is permissible for employers to ask employees, hey, are you experiencing any flu-like symptoms? So again, that could be a cough, a sudden loss of smell or taste, or it could be anyone that has a temperature of 100.4 or higher. That's the temperature that the CDC has determined is considered a fever. So if the employee calls in and tells you, or they come to you and say, hey, I'm not feeling well, I think I should go home, you can ask those questions, and then you should ask those employees to go home immediately. Let's say the next day, the employee says, you know what, I'm still not feeling well. I think I'm going to go see a doctor. So later the next week, you find out that employee has tested positive. What do you do? The first thing you want to do is you want to isolate that employee. So that employee's already been sent home per your policy, which is a great first step to stop the spread. But then you want to ask them to stay home until they're released by a physician. So the way they can do that is they can go see their physician. Right now, there are some flexibilities, being that a lot of physicians are pretty busy. It is permissible for that employee just to go to a clinic or to go get another COVID-19 test. And any negative test would then allow that employee to come back into the workplace. So what's also key here is you want that employee to identify any individuals that they had close contact with for a prolonged period of time. within the 48 hours before the onset of symptoms. So if you were notified today that someone wasn't feeling well and they need to go home, and then let's say next Tuesday you find out they do have COVID, the trigger was today. So today was the day that you were notified that they weren't feeling well. That was the onset of symptoms state. So 48 hours before that would be Tuesday. So who did they have contact with on Tuesday, Wednesday, and today? Those individuals are asked to be self-quarantined for 14 days per CDC guidance. So this doesn't necessarily mean that your business has to shut down, but what it does mean is that we're going to ask those employees to stay home as out of an abundance of caution so that the virus doesn't spread. You also want to consider some deep cleaning and disinfection in your workplace. So you don't want to, you want employees to feel safe coming back to work. So this can go a long way with that. The CDC has some really good guidance. If you look on their website, there's guidance on how to clean soft surfaces, hard surfaces, and whether you're indoors or outdoors, all kinds of equipment. So we recommend that you go there for that guidance. And then finally, you want to notify your employees. So the employees will have the right to know that someone in the workplace has tested positive for COVID-19, but you do have to follow privacy laws, which means that we can't tell you who's been tested positive. We also wouldn't be able to tell you anything that would make it really easy for you to figure out who the person was. So for example, you don't want to say, our HR person tested positive for COVID-19 if you just have one HR person. As part of that notification to employees, you want to also consider, are there any customers or guests or vendors that that individual had close contact with? And if there are, you want to establish a plan for notifying those individuals. So on our next slide, we're going to talk about reinstatement offers. So we're going to talk about what if an employee declines an offer to work. So if we advance to the next slide, we'll talk about the first thing we need to do here is to understand why the employee is declining the offer for work. So there may be legitimate reasons for declining offers of work. So the TWC, for example, has a list of items that says if an employee declines work for these reasons, that will keep eligibility for unemployment going. So one of those reasons could be, I have small children at home, but I don't have childcare because the childcare facility is closed due to the pandemic. The TWC says that's a reason that could entitle that employee to continue receiving unemployment benefits. So if there are legitimate reasons, the employee may continue unemployment. If they're not currently on unemployment, they may be eligible for any state or local sick leave, if that qualifies, or they could be qualified for paid leave under the Families First Coronavirus Response Act that Sheila covered earlier. Now, we also know we're dealing with this a lot with our customers is there are also employees that are giving us non-legitimate reasons for declining work. An example of that would be, I actually make more on unemployment right now because of the federal subsidy than I did at work. That's not a qualifying reason to refuse an offer for work. So as Sheila mentioned earlier, document, document, document. You want to have those offers of reinstatement in writing, and you also want to document the reason they refuse the work. The state does have a link for employers to report those refusals that we have available for you later on the slides. So take advantage of that. Another key is some employees are saying, I am actually afraid to come back to work. I don't feel safe. Fear alone is not a legitimate reason to decline work. So those employees, what we recommend there is that you just tell them what you're doing to be safe. You tell them what type of PPE you're providing and what measures you're taking to ensure their safety at work. And finally, if you are an employer that has 15 or more employees, you may have a responsibility to engage in the interactive process with the employee under the Americans with Disabilities Act. So what that means is it's just a conversation with an employee. So if an employee has concerns about exposure to COVID-19 about returning to work because they are at high risk, because they have underlying health condition, you want to talk to that employee about what those concerns are and see if you can come up with a plan. So what that law says is that you're required to make that accommodation so long as it doesn't impose an undue hardship on your business. So what's an undue hardship? It could be that anything that has significant difficulty or a significant financial burden on the business should you do it. So in these economic times, you could say that loss of revenue to your business is a reason you're not able to make an accommodation, or lack of employees is a reason that you're not able to assign duties to other individuals. Outside of that, some easier things that you could accommodate are if you have an employee that comes to you and says, I cannot wear a face mask because covering my nose and mouth makes it very difficult for me to breathe. In that case, you can say, well, what about if we move you to a place that has less exposure to individuals? What if we provide plexiglass? What if we provide a face shield? That could be a reasonable accommodation. Another example could be if you ask employees to wear gloves and you provide latex gloves, and an employee says, I'm allergic to latex. So something that you could accommodate there easily is to provide non-latex gloves. All right, and on our next slide, we're going to talk about workplace safety. All right, so as you see on the next slide, when we talk about the safety and health and returning to work, we've touched on some of these topics a little bit earlier, but we're going to encourage you to frequently clean and disinfect any regularly touched surfaces. That's doorknobs, tables, chairs, restrooms. Disinfect any items that come into contact with customers. Like Sheila said, we encourage you not to share workspaces or items, but if you do, you want to maybe think about implementing gym rules where employees know that they need to sanitize after use. You want to make hand sanitizer and disinfecting wipes, soap, water, all that stuff very available to employees. I know that when you go to grocery stores and other businesses, there are those hand sanitizer stations, wipes available, and that just makes people a lot more comfortable entering your business and coming to work. You also want to place visible signage in the business. So the CDC, OSHA, and other DOL has posters that you could post. Some of these posters are about respiratory etiquette. So what that is saying if you cough or sneeze, we want you to cough or sneeze into a tissue, then we want you to throw that tissue away. We want you to wash your hands, and when you wash your hands with soap and water, we want you to do that for 20 seconds. The reason we talk about it so much and the reason we recommend that you have this signage is because habits could be hard to break. So although we know this stuff, sometimes we forget. I know that recently I was at a grocery store and the person had plexiglass, she had a face mask, and she had gloves, and as she was scanning items, she rubbed her eyes. So again, it's bad habits can happen. It's hard to break. So these signs in the business can help us remember to do those things. And again, if you do practice any screening, whether you're screening your employees or you're having them do it themselves at home, again, we can't say it enough, but training is essential here. You want to know what you're screening for. You want to make sure that you're adhering to privacy rules and that managers are trained on what to say in the event that they have any calls from employees. All right, so then on our next slide, we're going to talk about employee engagement. So on the next slide, you'll see that when we talk about employee engagement, studies have found that about 13% of employees worldwide are engaged at work. So what that means is the vast majority of our employees are not engaged. That may not be surprising considering the current climate. Right now, what businesses do with their employees is going to have a lasting effect on their loyalty to their company, to their engagement at work, and their productivity. So some of the things that business can do right now is acknowledge the fact that right now employees are worried about the financial stability of the company. That's one thing they might be very worried about if you've had furloughs or layoffs. They might also be worried about their well-being. So whether it's them or if they have someone in their household that they're worried about because they might be at higher risk, that might be top of mind for those employees. And they also might be worried about job security. You know, will I have a job? Although we're not saying that you can make any promises, what we are saying here is that communication with these employees can go a very long way. So right now, what you could do best is have your leaderships acknowledge the fact that employees want to hear from them. So some of the tips that we have to share with you today is to encourage feedback. So you can do this in a few ways. You can do employee surveys. You can do those online. You can do those anonymously. And what those surveys will do is it'll get feedback from your employees. You know, you can ask them questions like, are you hearing from management enough? Do you feel good about coming to work every day? Is there anything else we could be doing to ensure your safety at work? Something else you can do is to take an active interest in those employees. You can have regular check-ins or one-on-one meetings. Be honest with them. So as I said, don't make any promises, but to the extent that you can, communicate and be honest. And then you can show some gratitude. So what if you have employees that never left? You know, what if you're an essential business and you have essential workers and they never did go home, and or maybe you have some that did and others that had vacation they had to cancel to ensure the business is sustaining and growing. You might want to say thank you to those employees. Recognition can go a very long way. Something else is if you took opportunities to give back to your community during this time. You know, if that's part of your core values and that part of giving back is what's important to you, you can take time to highlight that in social media outlets and say, you know, we gave back at the food bank last week. We're excited to share what we did. Something else that you can do is you can listen. So again, all of this is showing employees that you appreciate them. If they have concerns, listen, hear them out. It'll go a long way with these employees. And then finally, you can think of ways to connect virtually. So right now, if employees have been working remotely, or if some people have been furloughed, or if people are coming back, a good way to connect could be to have meetings with cameras on, kind of like what we're doing today. I know that we did that here recently at our employer, and it was very much appreciated. It was so nice to see everybody and to connect in new ways. So with that being said, I'm going to turn it back over to Sheila. She's going to highlight some key takeaways.
Thank you so much, Carla. And thank you again, everyone, for tuning in today. Just want to quickly wrap up on our next slide, talk about our document. So again, begin to document your return to work plan, and to remember that COVID-19 is an ongoing threat. So much in the news lately has talked about a resurgence and an increase in cases, and there's also talk about it possibly coming back in the fall. And so if you plan now and document your return to work plan, then you'll be prepared if it does resurge, or hopefully we never have a pandemic like this again, but you'll definitely be prepared. Or even if there's going to be a flood or a hurricane, you would be prepared in those essential times also. And also, again, keep a clean and safe work environment. We can't stress that enough, as Carla mentioned. Please make sure that you put that signage out. Make sure you're reminding your employees to disinfect and clean and wash their hands. And also remember that you can't do it alone. So involve your members of your team, and remember that lack of information breeds fear. So inform your management of your employees of everything that's going on in your return to work plan. So on our next slide, as I mentioned, we talked about several websites, and so we have listed several websites on this slide for you. The very last one is the information that you're going to do if an employee refuses to return to work. That's the phone number or the website that you would go to. If you need any help, on the next slide is mine and Carla's information at ESI. So if you need us, reach out to us, or you can always reach out to Sarah and Jody at PHCC. And right now, I'm going to turn it back over to you.
Thank you, Sheila and Carla. That was really great. There's a lot of good information and a lot to digest. We have received a couple questions, so I would like to share those with you and get your perspective on them. The first question that we have is, if an employee is confirmed positive for COVID and there are other employees who worked in close contact, but they do not show any symptoms, do you recommend that they still quarantine?
That's a great question. Carla, since you talked about COVID and testing positive, would you like to take that question, or would you like me to do it?
Yeah, I'll take it. So the CDC recommends that those individuals that have been identified as having close contact are self-quarantined for 14 days. So it's out of an abundance of caution to stop the spread. So they do ask that they kind of go home, they watch for symptoms, and they seek medical guidance if they need to.
And this is where that communication is going to come into play. That's why you're going to inform the employee why you're sending them home and why you're going to ask them to self-quarantine for the 14 days.
Absolutely.
Great. The next question is, what do you do in a situation where you're asked to send your techs or plumbers into a situation where somebody is already quarantined, or you know that they've already tested positive for COVID?
That's a good question and a very scary question. Carla, do you want to take that one, or do you want me to take it?
Yeah, I think it ties back into what Sheila was saying. So if you're sending people into that, are you providing them with the appropriate PPE to ensure their safety, right? Because a refusal to do something that is dangerous is permissible under OSHA. So you don't want the employee to feel like you're sending them into a dangerous situation. You want them to feel like you're sending them into a situation where you have full confidence that they will be protected from getting that virus.
Great, thank you. The final question that we had is if we are recording and if we will be sharing this webinar later for you, and we are. So if you do need a copy of it later, we'd be happy to share it with you. And if you do have any other additional questions that come up, please do feel free to reach out to us, and we would be happy to answer those or connect you to the right people. So with that, I just want to thank Sheila and Carla again. Your presentation was really outstanding and full of great information. we knew that you would have a lot of useful and great information, and we're very appreciative of you sharing that with us. Thank you.
Anytime, thank you.
So to our attendees, we just wanted to thank you again for attending and for your interest today. As a reminder, we are going to have part 2 of our webinar series on Thursday, June 18th, which is available to PHCC members, and we will get that information out to you so that you can register for that. And with that, we will close our presentation. So thank you for joining us today, and please stay safe.